Definitely welcome to Counter Diary. Counter Diary, we are telling the untold stories of Liberia. My name is Emmanuel Kotu. On today's Counter Diary, we are here in Gbarpolu County, and to be precise, we are in Gbarpolu City. So we're going to let you know exactly what is in Gbarpolu, talking about the schools, talking about the hospital, the police station, and the people here. So keep watching Counter Diary. We are telling the untold story. Let's go, Gbarpolu County. So we are staying here in Gbarpolu County, and to be precise, we are in Gbarpolu City, right in front of the Chiefjalalung Lone Medical Center here in Gbarpolu City. This is the major health referral center in this county, and also the government of Liberia is constructing a new hospital here called the Emirates Hospital. I understand it has about 100 bedrooms. I don't know how true is it because they have not opened it up, but then it's going to ease the pressure on this particular hospital. So let's get in the hospital and let us get to know exactly what do they have here, what are the challenges of the Chiefjalalung Medical Center in Gbarpolu City. Counter Diary, we are telling the untold stories of Liberia. So we have just entered the compound. This is the Chiefjalalung Medical Center. You can see it here. This is the main compound, and we are trying to talk to the administrator of the hospital. She's going to be telling us exactly what this place is made of and what are some of the facilities they have here. So keep watching us. Let me see if I can talk to anybody. How are you doing? So how are you, madam?
I'm good.
Okay, so my name is Emmanuel Kotu from Spawn TV, and this is the Counter Diary program. Today we are in Gbarpolu County, and to be precise, we want to talk about your medical center. So what is your name?
I'm Mrs. Ezo.
Okay.
I'm the hospital administrator for Jallah Lone Hospital.
Okay, so Jallah Lone Hospital seems to be like the major referral center in Gbarpolu County. Tell us a little bit about this place.
Jallah Lone Hospital not only the major, but the only referral hospital in Gbarpolu County. Yeah, so the hospital was established in 2009. And since it has been catering to numbers of citizens from Gbarpolu and out of Gbarpolu.
From Gbarpolu and out of Gbarpolu. Okay, that's good. So what are some of the facilities that you have here?
We have a lot of services that we own. We have our emergency ward. We have our OPD, the OPD where we do our screening. And we have the favor wards. We have the pediatrician ward. We have the general ward for male and female. We have the post-surgical ward. And we have the theater. We have the MCH.
So you do surgery as well?
Of course, major and minor surgeries.
Okay. But what are some of the challenges that you face here?
When it comes to challenges, there are lots. But just to name few, we have, when it comes to human resource, we have a challenge where to have qualified and trained medical practitioners coming here to work. It has been a challenge. And transporting patients from here to Monrovia, that has to be a challenge. You see our roads conditions, they are not very perfect, where to carry patients is become a difficult problem. Even few the ambulances to go for patients, even from here, Monrovia, or even from the other districts.
Because of the bar road network.
Because of the bar road network, that is one of the challenge.
Okay, and somebody will say, now that you're going to have all of these facilities, there's something on the way. The new Emirates Hospital.
Emirates Hospital.
So are you excited to receive?
I'm very, very excited.
Why are you excited?
I'm excited. Number one, I'm a citizen from Gbarpolu County.
Okay.
And still here to see that great development that has been initiated by the President of Liberia, Dr. George Mano Weah. That brought a joy to me. Even when we heard the news that our hospital was coming, we were very much excited, and we are still excited, still waiting to see it be turned over. to us to
Okay,
operate.
so this is a gossip, right? Am I we're live on TV? This is a gossip. I just got information they're opening in November.
Very good. See, I'm just hearing now.
So yeah, in November it should be dedicated and the Arab, because the Embry Hospital is actually not only in Liberia, they also have it in Dubai.
Okay.
Yeah, so they're gonna also open about. But I want you to take me through the facility to let me know exactly what you have here.
Okay, let's go.
Okay. All right, so let's go into the facilities. And where are we going first?
Okay, this is a ER, an emergency room,
Okay.
where we cater to emergency patients that will need immediate care.
Okay.
This is where we admit them and monitor them for 24 hours before taking them to the room.
Okay, so can we just the
Yeah.
camera? This camera can just come in to see. All right, so basically something is being done here.
Yeah.
And come inside. You know the facility. So you have. Okay. So these guys are busy working in here.
Is it working?
How you doing? Okay. So they attending to emergency situation.
Emergency situation right now.
Okay,
As
so
you can see, this whole unit you see, we have our EPR section.
When you say EPR, I mean I go to medical school.
Expanded program on immunization.
Oh, okay.
The vaccine.
So this is where people come to
This is
do.
where people come to do their vaccine, the children,
Okay.
the adults. Here we keep our vaccine. It's locked now. We have fishes here
Okay.
to keep. This is our mental health office.
Okay.
NCD means non-communicable disease.
Oh, okay.
Okay.
All right. So let's get to the other side of the hospital.
This is the administrator office.
Administrator. Okay.
This is another consultation room.
For the medical doctor.
Yes.
All right. We're going to the.
We are working toward the admission areas where if you have to be admitted for more than 24 hours. Here you see this is our OPD. You
Okay.
come here in the morning, we do your registration, and they take the chart and the data for you to be seen.
Okay. So that's one thing. While we're trying to get to the main area there, the issue of childbirth and how many children, how many pregnant women do you deliver here on a daily basis or on a monthly basis?
It depends on the patient load. At times we do about 50 deliveries a month or 36.
Oh, okay.
Yes. So here is a dispensary.
Okay.
When the doctor sees you and they send your child here for your medication.
Okay.
You can see, this is our nursing station. When
So
our
you can
nurses
see-
come to work, they sit there while they monitor our patients.
Okay. So get the nurses.
You see them, they are very busy now.
All right. So
This is our peace wall,
peace what?
the children,
Okay.
small children.
All right. So we can see there.
Yeah.
Okay. So we just go in there. Oh wow. Nobody got to tell you that Hello, baby. How you doing? Oh, okay. So this is for
The babies.
the young babies that are born today, tomorrow. Maybe they will be born tomorrow. They will come here. The future. Okay. So we stay in the Jallah Lone Medical Center. I better say Jallah Hospital.
This is another wall.
This is another one. Okay. So we just let's see exactly what is going on. Okay. So we can see in there. Okay. Okay.
This is our laboratory. You can come
Okay,
in.
so we should come in to see the laboratory. And there's this issue that we don't have equipment, modern equipment.
Of course.
Okay, so what are some of the equipment that you have here?
I don't know your thing.
Oh, how are you doing, my brother? I'm Emmanuel. Okay, just Emmanuel Kotu from Spoon TV, and your own county diary. So I don't know your name. Fema Yankwe.
Yeah.
What your position?
I work as a lab aide.
Lab A, okay. So can you tell us some of the equipment that you have here?
Yeah, we have some equipment here. Like nowadays, it's most 100,
Okay.
but now it's now working. Not that I have problem, but the reagent responsible for it to work.
Okay.
It's not available now. They expire when it brought it.
Oh, okay.
Some people are trained, but they are not here now.
What about the one I'm seeing behind there?
Yeah, we use it for urine. It's a urine centrifuge.
So you test the person urine?
No, we spin the urine in here before they can read it on the microscope.
Oh, okay. Wow. So the
This is
microscope.
We got two
microscope.
microscope.
You got two microscopes here. Okay. This is nice. So this is the microscope.
Yeah.
The two microscope. and then you check everything is then set there. Because sometimes some people say, you know, when you come to the rural area, you didn't get no facility, medical facility, a problem. You can even test good. So thank you, my man, Yankui. Thanks for talking to me.
Okay.
You know, at least for people to see what exactly you guys are doing here. Thank you. All right. So, madam, where are we going next?
Going to the MCH ward.
All right.
This is the operating theater.
Yeah, just
Body is Lagna.
This is what?
The operating theater.
So this is the what?
The delivery room.
This is the delivery room?
Yeah.
Okay. And then...
When you're in labor, you come, you stay here until you give birth. And we take you to the ward for monitoring.
All right. I see somebody smiling. You be better? Oh, I thought you'd be better.
One of the staff.
Yeah,
All right. So, what's good? How you doing?
You deliver, here where we bring you to monitor you for 24 hours. Or even if you went on a surgery, we still bring you here to monitor you until you can be discharged.
Wow. So I see some of the... How you doing? Okay. So these are people who have just given birth?
Yeah.
Okay.
See our young babies.
Okay. Yeah, thank you there. Thank God for your checking up. Madam, how you doing? Sorry, I'm disturbing your work. My name is Emmanuel Kotu from Spoon TV. What exactly are you doing here now?
I'm doing father son.
You're doing the father son on the baby?
Yeah.
Okay, how old is the baby?
Maybe 2 weeks.
Oh, 2 weeks old. Tell me, how's your work here? How is it like? Is it difficult for you? Get plenty pregnant women coming to you?
Yeah, sometimes we see pregnant with me, and some of them when they come with a lot of communication.
Oh, okay.
Like demand, like sometimes it can be anemic. Yeah, but we can manage.
Okay.
We can manage them.
Okay, man. Thanks for talking to me. Yeah.
Thank you.
Thank you. Thank you for the hard work.
If you need intensive care, you need that means you born a baby like that, critical, or maybe they came back sick, we monitor them here.
So what do you have here?
We have the incubator. We have the incubator, we have the scale, and we have the monitor.
So
We
you
the
have.
oxygen
So you
cylinder.
have the. This is
The incubator.
incubator, yeah?
Yeah.
For a, I want to know the function of this because I'm not in the.
This, we put babies in here that maybe will be having low temperature.
Okay.
Yeah, so we put it in here until they can recover.
Okay.
So we have the oxygen cylinder just in case the baby needs oxygen and we don't have current, we use that. If we have current, we use the concentrator.
Okay.
This is the cylinder. This is the
So the cylinder out there is used for.
yeah, when there is no current,
Okay.
you use that. But if you have current, then you can use that. That can only be used with current.
Oh, okay. Thank you. All right. So we've gone through the Chiefjalalung Lone Hospital or Medical Center here in Gbarpolu City. Finally, before we take leave of you as the administrator, what do you have to say to some of your people? I mean, you live in a place where most of the people don't want to bring their patient here. They want to be waiting until maybe the last minute of time before they can bring them for.
And we experience cases like that most of the time, but we still encouraging them. The first place to come is the hospital. So if your patient is sick, make your way to the hospital so that doctor will be able to see you and diagnose your problem. And maybe if we not, because it's not possible for us to handle the situation here or all the cases. Those that we are able to handle, we handle them here. Those that we are not able to handle, we refer them to Maserati.
All right. Thank you so much for talking to us.
Thank you.
All right. All right. So you are still watching Counter Diary, and we are still in Gbarpolu City, to be precise, in Chiefjalalung Medical Center. And we have spoken to the administrator of the hospital. We've gone through the wards of the hospital. It's about time we speak to the county health people there. But we have somebody who's I'm not going to ask him. I mean, I'm not going to be telling him, but he's going to do a full introduction, and we can go into the discussion. How are you, sir?
I'm okay.
Okay, so again, my name is Emmanuel Kotu.
All right, pleasure.
And you are?
Lasana Nkrumah,
Asna Nkrumah, you are the?
County Health Service Administrator for Gbarpolu.
Okay, County Health Service Administrator. So how is the health center like for for Gbarpolu County?
Okay, the health center is being controlled by the county health team, and the county health team supervises all health activities within the county. And so it means that definitely we also control the hospital and the clinics and all other health facilities. It is headed by the county health officer, and then assisted by the administrator, and then we 3 other senior managers.
Okay, so let's talk about Gbarpolu. How many health facilities do you have in the county?
We have 14 health facilities, excluding the hospital. So it's 14 health facilities, which is the clinics, as well as the hospital, making it 15 all in total.
Okay, and how is it like, trying to carry on delivery of healthcare? How is it like?
Service delivery is moving gradually, because Gbarpolu is a low challenge in terms of total development, basic social services. However, we are still moving the healthcare system.
And so the healthcare system, what are some of the challenges? We're talking about, low challenges and stuff like that.
We're talking about accessibility rules, right? We have 5 health districts, and of those health districts, we have 3 to be very challenging, which is we have Kungwa, hard to reach environment, and we have one of our major health facilities there that is catering to a population of over 60,000.
Wow.
Yeah, and close to the Sierra Leonean border, but that's the facility that is serving our entire catchment population. And the road there is very challenging. Getting there is tough. Mostly motorbikes move there. Vehicles move, but it's challenging because we have difficulties with the bridges, and getting there is tough actually. And then we also have the Bele Fasama that is currently inaccessible in terms of road, only footpath and motorbike.
Well, okay, the road cut. Bele Fasama.
There's no connection with vehicle reaching Bele, the clinic, right now.
At this moment, no connection to reach to Bele.
To reach there with vehicle.
So you use motorbike.
You use motorbikes.
And take for instance, there's another area I've learned about, the Gbarpolu district.
Yeah,
Bayekole, going down to Kodobani, all the other areas, Tegeta.
Yeah.
How do you guys go over there?
We use the same means, motorbikes and canoes. We have to cross 2 rivers in order to make sure that health services is delivered to the people at that level. So
you as an administrator, what keeps you moving?
We have few vehicles that we are managing. Sometimes there are other environments we don't use vehicles, and we have to also make sure that motorbikes, or we walk some distances.
Another thing,
that's the overall reason why we accepted to serve the nation. And so we are okay doing that.
Yeah, somebody would say that most of the professional healthcare workers don't want to come here because of these challenges that you have here. What's your own message to other people who need to come out to serve their Liberian people? Because I was coming here, the road is very terrible. And then somebody said, if this is better, I should go behind here, go to the better forest, and then they will know that I'm working. And what is your message to other young folks who are graduating from the various nursing institutions or the, Doclates, College of Health Sciences?
We want to encourage them to join this endeavor. Liberia is the only country we have. And we don't expect Chinese or Japanese to come and develop it for us. And we have to make sacrifices. Development is not a one-day thing, it's a process. And so in order for that to happen, it means the skilled professionals will also have to leave the comfort zone, move to these challenging environments so that gradually we can have value.
All right, thank you so much for speaking to us, and I hope that I'll come back. I'm trying to come back, and the next target is I want to hit the Bangi and all the other places.
We'll take you there.
Yeah, thank you so much for talking to Mr. Kroma.
Thank you so much.
All right, so keep watching Counter Diary. We are telling the untold stories of Liberia.